Okay, Dr. Deuk Majan here. We're getting ready to get started with the Deuk laser disc repair. And today we're doing something special. We're doing a T12L1 disc herniation. Not common, very rare that a T12L1 would cause symptoms, but our patient has symptoms at T12L1. There's a herniated disc and they have pain right there. So we're going to get going. I just had a conversation with our patient. I'm going to get started, okay?
Okay, when do I get to sleep?
Soon. Soon, don't worry. He wants to go to sleep, and I don't blame him. I need your help in the very beginning.
Okay.
And, oh, by the way, you're rotating on the AP very badly. We need to unrotate that, okay? So I need your help in the very beginning. Once I get where I need to be, then I can put you to sleep.
Okay.
Okay? Yes, we have to gain access, and then I got to do the discogram. Then you can go to sleep.
Okay.
So probably depends on how long it takes me. I don't know how long it will take me. Hopefully it'll be quickly, okay? But let me talk to my team and our audience. And if you need something, you just say, Dr. Deuk, and I'll answer it for you. But I need you to lay still while I do this, okay? All right, how's our blood pressure? We need to get the blood pressure down.
I'm working on it right now.
Okay, so I'm going to wait until our blood pressure is better. You can actually see there's a scoliosis occurring at T12L1, so there's rotation. If you look at T12, it's pretty much a straight-on AP shot. Then when you get down to L1, the nose is off to the side. That means the spine is rotated between T12 and L1. So, and also T11, 12. This patient injured his back. He was involved with a very unusual situation. Do you mind if I share your story? Huh? So he was in a massage parlor. He got a Thai massage. And, normally when you get a Thai massage, the masseuse will, part of the massage is to walk on your back. Believe it or not, they actually get up on your back and they walk. And what they're doing is they're walking on your spine, basically, and applying force to the spine to adjust or manipulate the spine at the joints. So kind of breaks up scar tissue, causes some inflammation, and then the spine's supposed to heal from it. So he's getting walked on, and this is a very big man. I mean, very strong, powerful man. And he's getting walked on by this masseuse, and he's going, "Oh my God, what is that?" And he turned around and looked, and you expect to see a tiny little Thai woman walking on your back, right? But he turned around and saw like a 200-pound Thai woman walking on his back. and he had sudden onset of pain, and he's had pain ever since then. And I'm not laughing at the pain you're having. I'm laughing at the idea of a 200-pound Thai woman, because there aren't very many of those, Most of them are skinny and petite. And that's why they're able to walk on people's backs, because they are skinny and petite. Well, this one must have been out to lunch when they read the manual on Thai women walking on people's backs to massage their backs. So, long story short, she injured his back in many places, thoracic, lumbar. He's had a prior 2-level artificial disc done at L45, L5S1. That was done in Germany 20 years ago. And he's done very well, had no problems. He just goes and gets massaged once in a while. And then this thing happened with the Thai massage where she basically ruined his back. As a result of it, he has herniated discs. And now he's here to have the Deuk laser disc repair and some rhizotomies done. So this patient has a combination of discogenic pain and facetogenic pain, both. I deal with the discogenic pain with the Deuk laser disc repair. Dr. Patel, my partner, deals with the facetogenic pain. And Dr. Kulkarni deals with the elevated blood pressure.
Do you want lunch or I'm more here?
Oh, Dr. Kulkarni, that just warms me up in the inside. Yeah. Well, we're on hold until you get that blood pressure down. Just so you know. So, yes, sir. Did you have a question for me? You're feeling what? You're relaxed. Good. Because we're not doing anything except making you comfortable right now.
Okay.
I'm waiting for your blood pressure to come down. But I don't want you to worry about it because it'll make your blood pressure go up. So you just have pleasant thoughts, and I'll take questions from the audience if you have any. So I get asked quite often, do I do thoracic endoscopic surgery? And the answer is no. The reason is simple. You have the ribs in the way. They usually will block access. But the real reason is that there's really not a lot of thoracic disc herniations that need surgery. The vast majority of them don't cause any symptoms at all. When people have thoracic pain, they really have pain most likely from the facet joints, which doesn't need surgery, it needs a rhizotomy. So you don't need disc surgery to fix thoracic pain. 90% of the time you need a rhizotomy of the facet joints to fix thoracic pain. Or if there's a fracture of the vertebral body, you need the vertebral body stabilized with a kyphoplasty. So the indications for thoracic laser endoscopic Deuk laser disc repair surgery for a herniated disc are extremely rare. But this is a case where this patient has a very rare herniation as a result of the masseuse walking on his back that was too heavy and injuring his spine. So their injury happened to occur at T12L1, which is where traumatic injuries to the spine most commonly occur. When we see patients coming in with motor vehicle accidents and spinal injuries, it's always at T12L1 or L1L2, exactly where this patient has his injury. So the fact that he has a thoracolumbar junction injury is usually an indication of a severe force applied to the spine at the wrong way. And that's what he's suffering from. So we're going to fix that disc herniation once we get the blood pressure under better control. Dr. Kulkarni just loves being here so much. She wants to extend her stay. Huh? All right. I think she said that the blood pressure controller is stubborn. Sometimes. That's okay. We still love you, Dr. Kulkarni. Yes. Love is a good thing. I love to talk. Our patient loves to lay here on the table. Ah. Oh, don't worry. We'll let you know. You just lay still. If you lay still, you're doing your job for me. If you feel pain anywhere, let me know. Just say ouch, and I'll take care of it. Huh? What's that? Yeah, lay still. You can go to sleep if you want. Yeah. Well, you're gonna be awake, trust me. You'll wake up if I need you to wake up, but we're not gonna give you medicine to put you to sleep until we're ready. I need your help. It's a complicated way of explaining the kind of help that I need, and I don't want to make your blood pressure go up anymore. But I need you to be a sensor for me. A sensor. You'll sense when something is not happening that shouldn't be happening. Let's put it that way. If you haven't watched our live broadcast of spine surgery from Deuk Spine Institute before, and this is new, welcome. I'm Dr. Ara Deuk-Majin, CEO and founder of the Deuk Spine Institute, located in Melbourne, Florida. We specialize in the most advanced spine surgery in the world. You won't find anywhere else. And we do also the old-fashioned stuff. We do it very well, such as fusions. Our patients go home the same day. Everyone goes home within 2 to 3 hours of their surgery being done. There's no hospitalization with our surgeries. Everything is outpatient. Even fusions. Even the kind of fusions that you would normally have done and stay in the hospital for 2 weeks, we do them outpatient. You go home 2 hours after your surgery. We've been doing this for the last 5 years, almost 6 years now at Deuk Spine Institute. All of our surgeries are done outpatient. Oh, blood pressure is good. I can move forward. I operate better than I talk. All right. We're going to get started.
Okay.
You let me know if you're feeling any discomfort, okay?
All right, eight.
Yeah.
Is it Haig or Haig?
I think it's high and English is big.
But why do you let the Odars call you Haig if it's Haig?
Exactly.
You shouldn't.
That's right.
The Hague is where you go to be tried for crimes.
Oh, that hurts.
Okay. Haig is you.
That's right.
Haig is a beautiful Armenian name.
It's the name of a king.
Huh?
It's the name of a king.
It's the name of a king.
Of course it is.
You're a king. Doctor D is a king.
Not me. Haig is the name of... Ada is the name of a king.
Right, that's my father's name and that's my middle name.
Oh, I like it.
You got it, Dr.
Ada
D.
Karatsik.
Yeah, you know the story, yeah?
Of course. All right, lateral. So we're talking about Armenian culture, Armenian history, because our patient is Armenian and I'm Armenian. I'm half Armenian. My father's side, my mother's side is... we need the table down
Table down. How much?
a lot.
A lot, okay? You have to tell me.
Good. No, that's too much probably. Shot.
Come on.
Just shot. Yeah, come up. More. For a neurosurgeon, a lot is like an inch. Okay, that's probably good. That's probably good. Okay, so it's weird. You can actually see the herniation on the X-ray. You don't see that very often. You know? All right, I need to focus now, okay? Good. Shot.
In time surgery starting.
Shot.
That hurts.
Oh, I know. Yeah, that's okay. That's, yeah, you're okay. I promise you're okay.
Take your hand.
Just lay still. Shot. AP. All right, so we're entering the foramen. And I'm going to do my best now to verify that we're at the appropriate level. All right, so where's the lateral view? That was the lateral. All right, so we're just outside the foramen on the lateral view. And the facet, we're passing. The facet is more medial, so we need to be a little bit more medial. Okay. Shot? Okay. Shot? Let's go lateral. Have some num-num. Local. Are you feeling any discomfort at this point?
No.
No? Did you say no?
No.
I can't understand what he
He
said.
said no.
All right, that's our lateral.
Right? Are you good?
You okay? Shot?
My hand with your his heart with your left hand. Good.
Shot? AP? So we're either up against the rib or we are. You see the two ribs there? Yeah. All right, so we're just above. So far, so good. And the lateral you have saved, right? It's right there. Shot. Let's go back to a lateral. I may want to start a little bit more medial. Alright, so we're pretty posterior on the lateral view, and then where the AP view is where? Right there. Alright, looking good. Yeah, it's looking good. That's shot. Shot. That's facet. Shot. AP. How's our blood pressure? Let's keep it down.
Keep it down, yes. Working continuously.
Uh-huh. Thank you. Okay. That's looking pretty good on the AP, and then the lateral is there. Entering the foramen. Shot. Where do you feel that? In your back? Shot. Lateral. Can we lower him a little more? I'd like to get him in the 90s. Is that better? 90s.
Okay.
Unless you have a reason not to.
No, it's just pounding tremendously, but
So that's our lateral. Shot. Okay. Our trajectory looks good. Let's try to balance out the fluoro a little bit more. I think we're off on the lateral. We need to, yeah. The ribs are really far apart. I want to try to line them up properly. Let's try the other way. Shot. I see. So let's try a little more because there's a double shadow at that back of the vertebral body. Let's see what that does. Shot. Let's try a little more. Shot. I think that's pretty good. What do you think, Luis? Yeah, we're hitting the facet, that's for sure. Shot. Are you comfortable? Yeah, you're gonna feel. Don't worry, but I just want to make sure there's nothing too bad. Shot. Shot. Where do you feel that? Right where I'm at? Right where I'm at? Uh-huh. The exact area of your back where your pain is normally? Shot. Let's go with an AP. I'm sorry? Okay. You're doing really good. Alright, so we're getting close to the disc on the AP. We're just a little below it. That's the problem. Probably hitting the end plate. And then on the lateral, we're not too far away. So we probably want to be, let me see. position. Shot. Shot. Let me have a fluoro up, x-ray up, sorry. Shot. Let me see lateral view. Shot. Shot and lateral view, and let me look at the MRI real quick. I need the MRI up. Go ahead and give me a sagittal. Sagittal T2. Yeah. Scroll. So that doesn't go all the way up. So let's see, that's 4, 3, no. Now go back to that. Scroll. Yeah, try the top one. That's better. Keep going. And keep going, stop. Is there a white one where the CSF is white like that? But just keep it there for a second. So 4, 5, 5, 1, 4, 3, 2, 1, 12. Okay, yeah, see if you can find the one where the CSF is white. That's too zoomed out. That shows the neck. I need just the kind of the lower back. All right, is that where we are in the lateral view? And the AP view is there. All right. Shot. 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 Where do you feel that? AP. Keep the lateral. I still think we're rotated on the lateral view. I'm going to have to help you. All right, that's looking good. Go back to a lateral. The AP looks perfect. And that's T12L1. I want to verify that with a sacrum up view. So we're going to do a moving view next when we go AP or lateral. Actually, we could do it lateral just as well. All right, good. So release the swivel. I can touch here, right? All right. Yeah, we'll go down. Yeah, God, are you kidding me? Shot. Shot. What do you think about that? It's really hard to say. I think maybe we're off. Is he laying flat? Lay still, please. Could it be that twisted? Again? 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 I actually think it's lining up better now. Let's leave it at that. I think we're good on the WAG too. Let's just leave it there. Are you comfortable?
Yeah.
We're almost done, by the way. Like almost done with you being awake.
It's just my neck is killing me.
I'm sorry your neck is bothering you. There's not much I can do about that right now. Can you try to reposition his neck?
I did actually, that's why.
It doesn't fall asleep on
All right, no symptoms down your legs or anything?
No.
Okay. Well, the good news is I think we found your bad disc. But I'm not 100% sure. We need to give him some something to ease the pain. Do you have some fentanyl?
I have given him already.
How much?
I have given him 100 bucks.
All right. Okay, well we're going to Are you comfortable?
Yeah.
I think we found the right spot.
Okay.
That's the good news. But you're going to tell me that. Shot. Did you feel anything there?
No.
I can't seem to pressurize it. How long ago was your injury?
Year and a half ago.
Year and a half ago? Are you feeling that discomfort that you normally get in that area?
Yeah,
I cannot. So it's the right area, right?
yeah. Right, good.
Well, I think he's just too tight. So let's go ahead and put him to sleep.
Okay. I can give him a slight sedation
It's,
and
yeah.
have him cooperate.
He's just clamping down because he's in pain.
Okay.
We're going to put you to sleep. When you wake up, we'll be done.
Okay, doctor.
Good job. I need you to count from 1 to 100 out loud.
Okay.
I need you to count in Armenian.
The only thing is my mouth is very dry.
That's okay, just count. You're going to feel a little discomfort in your arm. That's just the sleeping medicine going in. Let's verify we're in the right place. Let's come down. You can see the rib. You know, we're right below. That's got to be T12. So this should be T12L1. Come on down. Come on down. I need to see sacrum. You're going to do cine, and you're going to go north. All right, that's fine. The artificial disc is good. So we know there's 2 artificial discs. So that should be 4. No, I didn't want you to go further down. Go back up. Up, 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 up. Stop. Shot. Okay, that's good. A little bit further north. I don't hear the Armenian. 4, 3, 2.
Height? You think you can start counting?
Come down like a 1/4 inch or 1/2 inch. Shot.
Okay.
All right, there's the artificial disc. So 4, 3, 2, 1, 12. You agree we're at 12-1? All right, go back up. Lay still, Ig.
Yeah.
Lay still. Everything's okay. Can you give him?
I am giving.
Yeah, keep him relaxed.
I'm doing that. He goes acting very quickly.
Then that's fine. Take your time. Do what you need to do.
Thank you, Doc.
We need to get the patient asleep so we can do the surgery.
Yeah.
All right, so we're at T12L1 shot. We verified that with the X-ray, both the AP and the lateral view. Blood pressure is looking better, but I'd like to get it a little bit further down.
Please come down with your towel.
That's fine. Okay, shot. I can see the guide wire out the end of the needle in the disc space. There's some dye in the disc. I was able to get a little bit out, but this disc is so inflamed. Shot. So the more inflamed the disc is from its injury, the more scar tissue it's going to have. The more scar tissue it has, the harder it is to inject dye into a disc space. You add on top of that the fact the patient is awake and feeling the pain, then you can't really get any dye into the disc because it's scarred up, so there's not much space for it to go anyway, and the patient is clamping down on their disc because their muscles are spasming.
Is the situation better, Doc?
Is the situation better?
Yeah, where you're working spasm-wise?
Yeah, seems to be better.
Thank you.
Shot. All right. What is it? I can't hear anything.
Anesthesia mask, but I need to
Shot.
help you with your breathing, sweetie. Okay?
She's just giving you oxygen. It's okay.
Just keep taking deep breaths and you're going to sleep.
Shot.
You are.
Just count from 1 to 100 in Armenian for me. I know, that's the bad disc. We're right there.
He used to use alcohol a lot. So that maybe why the need is a little.
I don't know. All right, we're okay. Just lay still. You're doing great.
Good deep breath. I think it's better now.
Just let me know when I can proceed. I'm going to wait.
Height. Now,
Blade. Blade.
What?
Let us know when we can proceed.
then Dr. Gopering.
Isn't it funny how this You went to Amanpura, right?
Oh, me?
Yeah.
No, India.
Oh, you told me you were going to Amanpura.
Oh, Annapurna. No, in April.
April. Okay.
April 8th. Now it is too cold.
Where did you go in India?
Kerala, South India.
South India.
Backwaters.
Bihar, near Bihar?
What's that?
Is
Very
that?
hot. Yeah.
No, is it near Bihar? Bihar,
Oh, Bihar is up north.
up north.
This is down south. We went to Kanyakumari, which is the southernmost tip of India.
Oh, okay. What's down there?
Do you know Vivekananda?
What is?
Vivekananda. He was a philosopher
Shot?
who
No.
came to America in 18 something, and a very well known figure like Gandhi. And
Okay.
he said, oh, the other
Shot?
significant is that the three oceans meet.
Three oceans meet
Yeah,
in the
Bay of
southern tip of India.
yeah, Bay of Bengal,
Shot?
Arabian Sea, and Indian Sea. So we get to go and see that.
Wow, that's pretty cool.
And we will take, it's a holy place. We take a dip and all that. But
Shot?
it's beautiful.
All right.
I'll show you some pictures later.
I'm sorry? Last patient's doing great? Is her pain gone? Good. She's ready to go? All right, so for those of you who just heard, the nurse came in and told me our last surgery, the lady we just did, her pain is completely gone, her back pain that she's had for a long time, I guess. I don't remember how long her pain was there, but it's gone. That was the one we just did. If you want to rewind Facebook or YouTube, you can see it, or Periscope. Okay, shot. So we're doing the, tell Dr. Patel we'll be ready for him in about 15 minutes. Shot. They're going to lunch. Dr. Patel is at lunch? Will you let him know we're going to be ready for him in 15 minutes?
Are we going to go supine and put the patient on the contracture that he uses?
I'm sorry, are you asking me a question?
Yeah. Now, is he going to stay prone for him like this?
Yeah, he's going to stay prone.
Okay, because he uses that contracture.
I have no idea what you're talking about.
Oh, sorry. Okay, got it. Okay.
Yeah, I don't do the rhizotomies, so, but we need Dr. Patel here soon.
Yes.
This is not going to take too long. So, we want him here. Let's get him here.
Am I doing a good job for you, doctor?
Are you doing a good job?
Right now?
Is that a trick question?
No.
Look at the blood pressure.
So,
Whatever the blood pressure is, take 100, subtract it, and that's how good of a job you're doing.
you don't need hypotension right now.
No, yes, you said hypotension? It's not hypotension.
Hypotension. I'm just kidding.
I won't argue with you. The answer is yes.
You're happy. That's
We're operating in the spine. The last thing we want is a hematoma.
yes, doctor.
A hematoma would be in, as you can imagine, a very bad place. It would result in an emergency laminectomy, or paraplegia. Should I keep saying things? I don't like to talk about these kind of things. I've never had that happen. I don't want it to start now. Point is, keep the blood pressure down.
I'm doing my very best, except for nitroglycerin. So
Okay.
now, do you want me to start that or 140?
I don't know what you want to do. 114 is fine, but I'd like you not to let it creep up to the 130s and 40s again.
No, we've seen around 110.
Is he coughing?
I don't
So it looks like coughing. He's moving. He's bucking. So I don't know if he's bucking because he's coughing or probably coughing. He's not vomiting, right?
No.
So he's probably just coughing. Because I can see the Valsalva.
I know, it's just I'm trying to regulate his
Do you need any help? Or are you okay?
I could use that till I have to hold the mask with both hands.
Come on over.
He's a
Who
big
can
guy
help?
with sleep apnea.
Why don't you call Jordan, give Ann a call and tell her we need another nurse in here to help out.
You said you're almost done,
I'm gonna be done in 10 minutes. Why did she leave? I said to call. I said, Jordan, call Ann and get another nurse in here. It didn't say, Beth, leave the OR. People just don't listen.
Now, I need an oral airway.
Beth, I told you to have someone call Ann, but you come over here and help the anesthesiologist. Did you not hear me say that?
Yes, it was quicker to go get her.
I didn't ask you to go get her, and you need to get my permission to do that. If I give you an order, you have to fulfill it.
He may move a little bit. I'm trying to put an oral airway down.
I'm sorry?
He may move a little bit.
I don't mind the movements as long as his airway is secure and he's stable from your standpoint. I can hit a moving target, no problem.
Okay, I just need you to hold his.
Let's get some light on the matter.
Can you
And he's from,
can you turn his head?
number 2 up.
Can you turn his head to this left side?
No, we don't need that light.
He'll turn to this left side.
Not for us guys, light for the anesthesiologist.
Need that oral airway. Okay, take that pillow out, please. Take the pillow out. Pull. Okay. And I want you to keep. Okay. I need a stronger person here.
Jordan, please.
Stand by laser.
Says drop it down.
Fucking A.
Hold his head, turn to the left. I need Mike.
Mike, get over here. Leave the laser alone.
Mike. He's a big guy with. Hey, Michael. Can you help me
Stay
put this
there,
in?
Jordan.
Turn his damn head to the left.
Press ready. Press ready.
Oh, so when I stop, it turns itself off?
Huh?
When I stop, it turns itself off?
Hold it.
No, we press the stand.
What's the problem?
Oh,
Take this.
keep his
Scope.
head turned to the left.
Stop off.
What can I do with the body to help you?
Turn his. Okay.
You want me to pull his shoulders?
To the left.
This way? Towards me?
Yes. I need an LMA. I need an LMA.
Mike.
Need an LMA number 3. Michael. Okay, an LMA number 3. Open. Little goo for me. Can someone move his shoulder?
Come over here and help with the shoulder.
Someone move his shoulder, please. A syringe, please. A syringe. We need to turn him super.
Supine? You need me to come out?
Yes. Yes.
Coming out.
Okay. A syringe, please. 20 cc. 20 cc. Please the place. Someone 20 cc syringe.
Hey, come on, bring the stretcher. We got it.
Get all this off. Get the scope out. Yeah. What?
Michael. Fill the. Hey, Don. Wait. Fill the cup. Hey, Don.
Just you focus on his airway and stabilizing his breathing. Don't worry about his back. That's my job.
I'm going to go with soda.
Did you find it? Okay, let's stop for a second.
You have to move the machine off and then go that way. Be careful, don't hit the wall.
It's up to you. If you can keep his head turned to the left somehow.
So for those of you who want anesthesia for every single pain management procedure ever you get,
Put some air, please.
you understand the risks include
I want you to put
potentially being too deep and not breathing. Our patient's fine, and he's going to do just fine.
Yeah. Keep it sterile, please.
Keep all that sterile. Do you want him on a gurney or not?
No.
Get the gurney out.
Just keep your hand.
He's being ventilated. He's fine.
Maybe we can put a strap.
So really the what needs to be done now is the rhizotomies. So if you want, we can put him on the gurney if you want to, or we can keep him here. It's your choice.
How long is that going to take?
Rhizotomies are going to take, what would Patel take?
50 minutes.
No, but he's got a lot. He's got multiple levels.
Okay, 30 maybe?
So the side thing with him,
Huh?
side thing with him, he has a difficult airway, large tongue, obstructive sleep apnea, non-compliant with CPAP, doesn't use it. So as soon as he gets sedated, I have an anesthesia mask from the beginning, so I can support assisted breathing.
Just let's decide what's the best thing to do, because I'm pretty much, huh?
Plan I'm thinking is to leave the LMA, okay? And for him, patient probably doesn't have to be that deep. Is that my understanding?
For rhizotomy? I don't think so. I'd rather him not be that deep. We don't want to
He needs
risk.
come right now, then start doing.
Yeah, let's get Patel in here. Where's Dr. Patel?
Mike,
He's on the phone.
we have done.
Who's talked to Dr. Patel?
We're done, sir, right?
Yeah, I'm done. You can close the incision.
Yeah.
Well, that was an abrupt ending of my part of this patient's care. Fortunately, I was able to get done what I needed to get done, albeit in a more abrupt and rapid way than I was hoping. But patient is safe, patient stable. We're going to move on to the rhizotomies. So why are you taking the drapes off? Does Patel not like the drapes on?
Yeah, I just need to put this one over here, and then I'm gonna open here for Patel because it's my natural.
But why didn't we drape it that way to begin with? Right?
I just need to put the stereotypes. Close this.
Yeah, go ahead. All right, so Dr. Patel is going to come in and do the rhizotomies. I marked out on his back where his pain is, where his facet pain is. I put a line above, line below, and then there's another zone, and there's lumbar.
Okay.
So she's stabilizing him. He's got a big tongue, and he's obstructs easily if he goes too deep. So she's keeping him light. Is that going to be okay for you? I'll head over to the conference room and answer questions. So type them up.
All right, everyone, thank you for joining us again for the post-op Q&A. We have Dr. Deuk in the room with us. One of our first questions comes from a viewer on Facebook who says, I have a pinched nerve in my tailbone. It's very painful to sleep with, and I've been taking Aleve Tylenol to get through the night, but recently they've stopped alleviating the pain. What is the best treatment option for me?
Okay, well, first of all, thank you for tuning in. I'm Dr. Ara Deuk-Majan, CEO and founder of Deuk Spine Institute. We've just wrapped up a Deuk laser disc repair at T12L1, and people have asked me before, do you operate on the thoracic disc herniations? And as I talked about during the surgery, no, we don't normally. It's possible we might start doing some of them, but I'll be honest with you. For every 100 disc herniations out there that need surgery, about 70% are lumbar, about 29% are cervical, and maybe 1% is thoracic. So thoracic disc herniations that need surgery are extremely rare and unusual, and we rarely ever see them. That being said, certainly can happen where you would have a thoracic disc herniation that causes symptoms that need surgery, but it's not common. Today we did a thoracolumbar disc herniation, T12L1. As I stated during the surgery, our patient had a traumatic injury to their spine. They had somebody stand on their spine while they were laying down. It was supposed to be in the setting of therapeutic massage, but unfortunately there was way too much force applied to the spine through the feet of that person standing on his back, and it actually injured his disc at T12L1, as well as there's a thoracic disc herniation. I think it's T910. And he has facet syndrome at multiple levels, including lower back and multiple places in the thoracic. We're going to be treating his facet pain with a rhizotomy. That's what Dr. Patel is working on right now. I just did my part where I did a Deuk laser disc repair. If you watch the surgery, you notice that we had to end the surgery very quickly. That's because our patient's airway was obstructing, meaning that when you go too far asleep and you have a really big tongue, your tongue will actually obstruct your airway. Now, we call this obstructive sleep apnea, and a lot of people have obstructive sleep apnea, and they're not having surgery, but they actually have obstructive sleep apnea because they have a very narrow airway, and the soft tissues just kind of fall back and close off when you go to sleep. So these people never actually sleep very well because they end up having their tongue, basically, the base of the tongue closes off the airway so they can't breathe. So they start to fall asleep, they get deep, and then the tongue obstructs, they can't breathe, and they wake up basically choking, gasping for air. And so that happens to a lot of people around the world with obstructive sleep apnea. And as a consequence of it, they don't sleep very well, they're very tired during the day, they have headaches, they're moody, kind of describes me, right? But I don't have obstructive sleep apnea. I just don't sleep because I'm so busy working with my 5 companies, and I don't get an opportunity to sleep very often. Long story short, we had to end the surgery for the safety of the patient. We didn't want anything bad to happen. He was starting to obstruct because he went deep with the propofol. That being said, he's fine, safe, everything's perfect. Dr. Patel is doing rhizotomy. Our patient's going to do fantastic. I'm going to answer our question. I'm giving you an opportunity to type up some more questions, and then I'm going to answer this question. Then we're going to shut down this live stream. We're going to go to the recovery area, and you're all going to have a chance to interview our patient who just had surgery. And we did a 2-level Deuk laser disc repair. We got done about an hour or so ago, and she's ready to go home with her husband, and she wants to say something to you all, but it'll give you a chance to ask some questions. So type up those questions. All right, so our person who's typing in has a pinched nerve, they say, in their tailbone area. They're having horrible pain, and they want to know what can be done about it. Well, you can be healed. That's what can be done about it, and I can help you. Deuk Spine Institute can cure your pain. I just need to know exactly what needs to be done. If you'd like to know exactly what needs to be done prior to you traveling here to get fixed, then send me your MRI or a CAT scan, and let's do a quick video conference where I can do an examination and see what's going on. So all of these services Deuk Spine Institute offers for free. Why do we offer it for free? Because nobody else is ever going to give it to you for free. And there are a lot of people out there that basically don't want to travel. They don't really know for sure what's going to happen. They don't want to invest the money and time and effort into going somewhere just to be disappointed and find out that they can't be helped. And I honestly, as a doctor, I don't want to drag somebody halfway around the world or from anywhere, come here and find out we can't fix them. So the video conference and the MRI review is actually really good for people that are suffering with back or neck pain and want to know if Deuk Spine Institute can fix it. In general, the answer is yes, 95% of the time, without even calling me or sending me your MRI. 95% of the time, we can fix your problem. But there's about 5% of the patients out there that have a problem we can't fix. It's very rare that we can't fix their pain in their neck or back, but there is about 5% of the patients that we can't fix. So if you want to know for sure, can we fix you, what procedure will be done, how much will it cost me, when can you do it, then I strongly recommend you take advantage of our free MRI review and free video conference. It literally is just there to benefit you, the patient. And that's why we do it. We do it as a public community service, because we like to give back to the community, we like to give back to people, we like to help people, and it's something we can afford to do right now. I don't know if we'll be able to afford to do it in the future as we get busier, but we can afford to do it right now, and it's just, in my opinion, it's the right thing to do for people. So since I'm the owner and founder, I get to make those kind of decisions. Pretty much everything we do here at Deuk Spine, I have some say in. So we're not owned by a corporation. We're not owned by an investment company. We're not owned by people that need profit, though it's nice to actually cover our overhead. We're owned by basically me and my wife, who helped me build the practice, and my employees, obviously, who helped. But we're a privately owned company, and we're not in the business to make money as a profit. We're in the business to literally help people get out of pain. And so we don't have to answer to somebody higher up that all they're looking for is to generate more profits. We actually answer to our patients. And if our patients are happy, we're happy. If our patients get the best quality care, we're happy. If our patients get the very, very best there is in the world available to treat pain, then we're happy. And that's really our mindset. Unlike many places that are trying to cut corners and reduce costs by going cheaper and buying less expensive but also less effective treatments to apply to patients, we're not like that. We only have the very best, and it shows in our results. So I hope I answered your question. Anybody else out there with the same question, can Deuk Spine help? What can be done for my pain? Send your MRI in or CAT scan in. Let me review it personally and do a video conference with you, and I'll tell you exactly what can be done. All right. Do we have another question? That was our only question, I'm being told by Sean. I want to thank Sean and the rest of my team. We had a good day of broadcasting. Hope you learned something. And join us next week. We have surgeries on Tuesday and Thursday.